Alrighty, so my name is Brianna Garcia. Today I have Maisha Banks that I will be interviewing. She is a women's health nurse practitioner and an advanced PRN. She is currently working at Pelvic Rehabilitation Medicine of Dallas. She is at a clinic over there. She works with 2 physicians herself, which she's a nurse practitioner, and then they also have a health coach in the office. This pelvic rehabilitation is also nationwide, so this is just one of their locations. She graduated with her bachelor's in 2003, and she got her master's degree in 2007. And she has been a nurse practitioner for about 17 years. She graduated from Ohio State University. All right. So first question, Maisha. If you can think back to when you first started practicing as a nurse practitioner, what was 1 or 2 of the biggest struggles you faced as you transitioned from an RN to an NP?
Yeah. I think first was finding a good fit, like finding a position, like a job that was for advanced practice, especially in women's health.
Yes.
Like it was very challenging at first to find a position. They seemed to be like few far and in between, and that specialty just hadn't really like caught on, I don't think, like it has now. So after that, like, once I did find the position and could start to utilize, I guess, a bit more of the autonomy, right, that you learn and you're, provided with that advanced practice degree, it was challenging to kind of be the decision maker. You had the opportunity to see a patient and make all the decisions, and you didn't need to necessarily get other input from a physician. And I think initially that was challenging. Like, okay, I've got to decide what to do.
Yes, I could definitely see that.
So yeah, those were the 2 biggies for me.
That's a good point. As far as the next question, so considering your scope of practice and the regulatory bodies within the state of Texas, do you agree with the regulations of your licensure designed by the state?
For the most part.
Okay.
For the most part. I do find still there are, instances that can be a bit frustrating. I've had instances where I send prescriptions and the pharmacy calls back and needs to know the collaborating physician's info. Like they want all of the collaborating physicians, DEA or NPI or what have you. And I have full prescriptive authority, It should not require the information of my collaborating physician. And so that, can sometimes feel like it bogs you down. It takes time away that, you could be doing other things. Now you've got to talk with the pharmacist and provide all that info. And then it's just like, you feel a little slighted that there's not a general understanding that, I have this authority all on my own, that this shouldn't necessarily be required. Right. Yes. So I don't know where that changes, or how that changes. How do, we disseminate this information to educate, collaborators, pharmacists, physicians, et cetera, about what is really the full scope of the NP's practice.
That makes sense. So you would just say, like, autonomy wise, that would probably kind of be a change that you wish could kind of be made, if that makes sense. Okay. And then do you consider yourself working in a collaborative practice? How often are you collaborating with other professionals? And then can you also provide a clinical scenario where you sought clinical consult with other professionals, and how did it help with the patient's outcome?
Yes. So in our setting, we are daily collaborating, most often with pelvic floor physical therapists. So treating pelvic pain that requires me to collaborate with the pelvic floor specialists in PT.
Mm-hmm.
And so there's, constant communication there between PTs and myself for patients. I'm in the office with a physiatrist, and so that is a doctor who is a specialist of muscles and nerves.
Mm-hmm.
And so if I feel as though my knowledge and skill is not necessarily reaching what needs to be reached for that patient, then I certainly will talk with the physician here to just kind of discuss a little bit more in depth, how to address these muscle nerve issues beyond what what I feel capable of.
Yeah.
I am often collaborating with a surgeon, so while my medical treatments are definitely helpful, sometimes we just have to get in there and do some sort of a surgery. And so I have to present that information to the surgeon, about why I think this patient is a good candidate for surgery, let them know how successful they were with alternative therapies or not. And so it really is all about servicing the patient well. So that collaboration, between all of those different specialties is definitely to ensure best patient outcomes.
Yes, and just to touch base on that, Maisha was actually my nurse practitioner not too long ago, and she provided some steroid injections for me for my pelvic health. I was going through chronic pain, and she actually made a difference. So that's why I chose to interview her today, just because she was a big inspiration in my life, and she also helped me a lot. So that's the biggest thing. Yes, is you actually inspired me to go to nurse practitioner school because of it. I just feel like over here in Lubbock, where we're at, we don't have many of those resources here. So I feel like it would be kind of, it'd be kind of good to kind of bring something like that over here. I work with patients all the time who are having surgery for endometriosis. They're doing the diagnostic lapse. And so I always, I could feel like they always benefit from seeing one of y'all over there too. So I'm always sending them to you guys. Yeah. So just wanted to touch base on that. And then as far as another question, what are the most important skills and attributes for someone pursuing a career in women's health? So what advice would you give me? How could I go about getting into that scope of practice?
How can you go about getting into this specialty?
Mm-hmm.
Okay. So I think that a great place to start is where there is a place of need, right?
Yes.
And I think that's probably true across any specialty. For nurse practitioners, is I think that we really find that we learn the most and we serve the most when we are in a position to where we can really help reach underserved,
Yes.
And so if you can identify an area of need where, a practice that maybe is lacking someone to really help educate their patients, right? I think nurse practitioners are great educators.
Yes.
The skill to be able to really break down what all of the medical jargon means and get it down to your patient's understanding and really kind of meeting them where they are so that they can make some informed decisions about their health care. I think, that's what nurse practitioners are here to do. So in women's health, especially, I find that healthcare systems that have clinics in place that are serving underserved. So if you're in a place where perhaps a hospital system is, funded by the state, has, women's healthcare services that, are funded by the state. So, we have a big hospital system here in Dallas that if you are uninsured, this is the hospital system to get involved in. They help find coverage for your care, whether it be through grants or what have you. So they help their patients apply for, funds to help with their care. Teaching organizations, right? So teaching hospitals, that sort of thing, definitely are much more likely to have a a clinic setup where there are patients that are, Medicare or Medicaid or completely uninsured that can come and receive health care. And so when nurse practitioners are in those places, it's pretty amazing that you have folks who are sometimes used to not feeling heard or feeling like the care that they're receiving is subpar.
Yes.
And then you get nurse practitioners in these places that can really help educate, help validate these patients' experiences, and really provide them with top-notch care, because we're always making sure that the care we provide is evidence-based, and it's been researched, and it's, the latest and greatest. We want to be able to provide the latest and greatest recommendations to everyone. So those are great starting points. I think they help me feel the most fulfilled, and I learned a lot, and you can sense the appreciation from your patients for what you do. And I think that's what kind of fuels you. That's what kind of like keeps you going, and even in the position that I am in now, I don't necessarily find myself treating underserved as much from a financial standpoint as I am from the condition that I'm treating, And so while patients that cross my path now definitely may have some resources for their care, they are still dealing with conditions that go unseen, unheard, unvalidated, the severity of their experiences. And so it's kind of shift from that aspect, but still you find yourself in those spaces where there's great need. And so if you can seek that out, if you know where the places are that are servicing the folks who are in greatest need, I think that's where you're going to find your sweet spot as a new NP.
Perfect. Thanks for touching base on that. That definitely helped.
Yeah.
As far as office setting where you work, what types of medical decisions do you have the autonomy to make? And then, well, of course, you work with the doctors next to you, so that helps with the collaboration and consultation too, which you touch based on that.
Yes. And our founder and chief medical officer is always a phone call away, because we are nationwide. She's licensed in every place that we have a clinic, so she can certainly still collaborate with me here. I just had a patient case the other day that I contacted her about because I just wasn't 100% confident that the treatment that we offer was going to be what that patient needed. And so I wanted to really just report off to her. I gave her the whole scenario, about what was going on with that patient, and then said, what do you think? The things that we do, is there a space for this, or is this really more appropriate for someone else? And so we decided that it was probably a different specialty that really needed to take over that patient's care. But yeah, so that, you always have the experts, the boss, right? So even though in a way you are your own boss, but then you still want to feel supported, by the physician that you're collaborating with, to where when you feel like the decision making has reached a higher level, that's what they're there for. So I am independently assessing patients, and so the physical exam to determine if there is neurogenic inflammation in the pelvis, if there is a hypertoned pelvic floor that could be leading to chronic pain symptoms. I'm collecting all of the history to decide, what's been effective in the past, what hasn't been effective in the past, maybe even identifying the root cause of the neurogenic inflammation in the hypertoned pelvic floor. And some patients come to me understanding that cause, and some don't. And so I also have the role of explaining and educating, okay, here's how we landed here. Here's why you feel the way you feel. And then once that history collection and that exam and information is gathered, then I also have the opportunity to autonomously decide how to proceed with their treatment. Are they a good candidate for the steroid injections? Where to put those injections, other medications that could be prescribed to kind of keep them more comfortable throughout their treatment process. And so I do have a DEA number because sometimes that does include some controlled substances. And while we try to limit dosage and time spent using those controlled substances, sometimes they are appropriate, for short-term use. And I'm able to completely make that decision about whether or not I feel that that's appropriate. So, it truly, I have my own schedule. I'm not only helping out the physician's schedule and seeing some patients here and there. I have patients that are scheduled strictly to see me. And I am their provider, with, of course, the support of the collaborating physicians. So.
Yes, I love that. It just makes me excited to kind of get into this. But that concludes all of my questions that I have for you. So I do appreciate you taking the time to interview,
Absolutely.
Or to let me interview you.
Yeah.